Hello, everyone, and welcome to The Wrap, brought to you by Michigan Medicine Headlines. I'm Dan Ellman with the Department of Communication.
And I'm Hunter Mitchell, back and better than ever as Dan's trusty co-host. Today, we're going to discuss the unique Psych Tank competition and how it will help push research forward and improve mental health outcomes across the country.
Now, before we get into that important conversation, be sure you psych yourself up by checking out any episodes of The Wrap you may have missed. You can find the shows on iTunes, Stitcher, Google Play, or any other podcast hosting platform. New episodes can also be found on the Michigan Medicine YouTube channel and as part of the Headlines Week in Review every Friday.
Well, on that note, let's bring in two members of the team at the Eisenberg Family Depression Center, which is hosting the Psych Tank funding competition. Can the two of you first introduce yourselves?
Sure. I'm Sri Johnson. I'm the director of the Eisenberg Family Depression Center.
And I'm Karen Dugas. I'm the manager for the Research Innovation Core at the Eisenberg Family Depression Center.
Excellent. Now, as we mentioned, the Psych Tank competition comes out of the Eisenberg Family Depression Center. Can you give us a little bit of background on the center and what drove you to create an event like Psych Tank?
Sure. So the center's been around for a while. It was founded about 20 years ago by John Graydon. And it was the first depression center of its kind in the U.S. And now there's over 25 around the country. And over the past 20 years, it's done a lot of great work, and particularly around catalyzing conversations around depression, bipolar disorder, and other mental health issues across our schools and our communities, and reducing the stigma and how we really have conversations and talk about it. We're transitioning in the center to a new phase with the naming and the structure, and we feel like this is a really critical time in depression, mental health research in a lot of ways. In a lot of ways, we're all familiar with the pandemic has really changed stress and how we experience things. Our healthcare system is overburdened, and the wait list to get into mental health care are long. And we're more aware of how so many different things in our life, from our social connections to how we sleep and the news and our workplaces, all affect us. And in parallel, there's been really big and important advances in a lot of fields that are relevant to mental health, like technology and data science and epidemiology. So what we're trying to do in sort of this new version of the Depression Center is to catalyze conversations and then really research and robust interdisciplinary research that brings these fields together in ways that we can really solve these problems and finally make headway in reducing the burdens and effects of depression, bipolar, and other illnesses on all of us. So Psych Tank is really an exemplar of how we're hoping to do that. Really find innovative and new ways to bring sort of the best ideas and the most creative ideas that have a chance to change the field and give them the platform and the resources to succeed. So that's what we're hoping to do with this event.
Wow, yeah, that sounds really exciting. Can you tell us maybe a little bit more about the live pitch competition? What is the format and what are the researchers competing for?
Absolutely. So Psych Tank is an opportunity for researchers to compete for funding by pitching their innovative ideas to a panel of judges and a live audience. So it's going to be a hybrid event. We'll have an in-person audience, and then folks can also Zoom in to watch it. And participants can receive up to $150,000, which can make an incredible difference in moving their research forward. And there's two different types of awards. Our Breakthrough Award, which is for longer-term projects, and those can receive funding up to that $150,000 prize mark. And then the Seeds of Change Awards are mini grants for low resource, high impact innovation projects. And those will be for $10,000 mini grants. And we're looking for researchers and research teams to apply right now through July 11th. The deadline for the applications closes at noon Eastern time on July 11th.
Great. Now, I know the application, I've read it over, and it calls for, quote, innovative ideas in depression and bipolar disorder research. I feel like innovative, in that sentence is sort of a powerful word. What sort of is going to be considered innovative when it comes to these projects?
Absolutely. So we're really open. We do think that innovation means thinking creatively taking risks, and even being vulnerable. And we're looking for ideas that really break new ground. So, for example, an innovative idea for depression research might be to work with a new population, or use a new methodology, or add an intervention strategy to a basic science study. It could also be, if you focus on intervention studies, to take a prevention approach to your work. But we firmly believe that innovation happens at the intersection of disciplines, with the sharing of diverse perspectives, knowledge, and skills. And we want to empower a diverse research workforce to get behind mental health. We know that, depression impacts and is so closely related to many other fields. And so we want to spark those collaborations and bring those novel ideas out into the open. And Psych Tank is an opportunity to get those innovative ideas into the spotlight and get rapidly funded. Traditional funding opportunities are much slower oftentimes, and often rely on significant prior work on the topic. And with this event, we really are aiming to get truly groundbreaking ideas off to a running start.
Now, the application also states a preference for prevention projects. Why is prevention a focus over maybe treatment innovation?
Great question, and we're certainly open to ideas on treatment or other approaches to depression. But traditionally, the field and mental health has really focused on treatment, and we feel maybe not enough on prevention, and that there's really great promise in thinking of creative new ways about prevention. First of all, there's certainly a need, as we talked about, that the number of people suffering from depression is great and getting unfortunately higher during the last few years. And many people who need it are not getting care. And even those who get care, our treatments are not perfect. Most or many don't respond, at least to the first treatment, and many don't respond to any of the treatments we have. On the other hand, we really do know a lot about a lot of factors that are really involved in your risk for depression, and could make really good targets for prevention and really transforming how we live in our schools and workplaces and families, our culture, and then our sort of lifestyle habits like sleep and exercise and food, and then lots of other things that probably we don't know about but can play a major role in prevention. And we have a lot of new tools and approaches with data and engineering that can help understand all those factors and how they play together. So this is a place where we can really take advantage of the incredible breadth of strength across Michigan and really pull people together who haven't been working together before. And prevention is one place where we feel like that can really be an exciting and really productive collaboration. So there's other areas like treatment and other approaches to depression that can also there, but we think this is one that we really want to focus on in the coming years.
Now, I know you guys are both super excited about this competition that's coming up. Why do you think the event will be so successful when it comes to depression research? Is it the collaborations that it's going to spark and things like that, or are there other reasons why you're really hopeful that this will be a successful event?
Well, first and foremost, we know that there's such an urgent need for progress in our field. And so encouraging researchers to approach depression from a new perspective with new tools, new collaborators, that's when we're going to see transformation. And we also know that depression impacts so many aspects of our lives and throughout our broader culture and society. And by publicizing the need for progress and giving innovative minds the platform to share their ideas, we hope to inspire new lines of thinking and exploration. And then we'll see an impact.
Now, when it comes to mental health news, we've all seen headlines with words in it like crisis and epidemic. And what can we do as mental health advocates to address the growing concern?
Yeah, well, I mean, we've seen those rates of depression rise and continue to increase over the past several decades. And most recently, we've seen reported rates of anxiety and depression triple during the pandemic. So, as Srijan said earlier, access to treatment is limited. We have an overburdened healthcare system, And we also know that the fact is that people who suffer from depression and bipolar and other mood disorders often don't feel empowered to seek help. There's a lot of stigma and shame around having a mental health issue that folks are dealing with. So one important action is to really prioritize mental health and not being afraid to talk about the urgent need that we have and empower other advocates across the university and in our communities to share knowledge and resources in order to best serve our community and the members of our community. And again, we want to be able to help those suffering today and to also create resilience in our communities for tomorrow. Increasing awareness and reducing stigma remains incredibly important. And we're really passionate about this.
All right, so let's circle back to the Psych Tank competition itself. People want to apply, if they want to learn more or even just RSVP, where can they go?
Yeah, folks can check out the whole event description and apply to compete again by July 11th at 12 noon Eastern time at depressioncenter.org/psych-tank. So once again, that's depressioncenter.org/psych-tank. And we hope that the community joins us on September 19th for the live event. And so again, you can RSVP at that same website, depressioncenter.org/psych-tank.
Awesome. Well, thank you so much, Sujran and Karen, for sharing this information today. If you want to learn more about the Psych Tank, go to mmheadlines.org. That's mmheadlines.org.
All right, so now the easy part is out of the way, and it's time for the lightning round when we ask one of our guests 4 quick fire questions that they haven't seen before. Srijan, you lost the coin toss before the show, so you'll be in the hot seat. Are you ready to go?
I'm ready.
All right, perfect. I got the first question for you. So the 4th of July is just a few days away. What's your favorite holiday to spend with family?
Wow, that's priming me to say 4th of July. I do enjoy 4th of July. I love barbecues and picnics, but in my family, usually Thanksgiving is the time where most of us come together, and it's a great event. And for me, it's a bonus because it's also often my birthday, so people have to get me presents that normally wouldn't have to. So I very much enjoy Thanksgiving.
Awesome. Now, I wonder if you saw our script beforehand, because the next question was, what do you prefer on the 4th of July? Barbecues, picnics, or fireworks?
Oh God. I mean, thankfully we usually don't have to choose, but probably if I had to choose, then barbecue.
Awesome. Well, on a more serious note, if you could give your younger self one piece of advice, what would it be?
Oh wow, that is serious. Probably a lot of things, but I do think enjoying and hopefully relevant to the broader conversation, I think taking the time to really enjoy things like holidays and time with family and prioritizing the social connection and the things that keep us healthy are both also enjoyable and help our well-being, but probably help us sort of in the long run as well for things like depression, but all of our lives. So I think really, particularly in the context of these sorts of holidays and gatherings, prioritizing and enjoying those moments as they happen.
All right, now I am convinced you have seen our script, because that led perfectly into the final question here. We've talked a lot about mental illness and wellness and things like that today. So from a wellness perspective, what's your favorite thing to do when you need to take a break from work or just relieve stress in general?
Yeah, good question. I think it's really important for each of us to find those things and what they are for us as individuals, and then prioritize them. One thing I do like to do, and I'm proud of, is socialize, and particularly socialize with my Connor O'Neill's pub trivia team, and we are the defending champions in because of a very good geography and 80s music round. So that winning also helps the well-being. So a lot of different things, and spending time with my 5-year-old, but this week the pub trivia is the top of the list.
Do you have like a ridiculous pub trivia team name?
We don't. We're uncreative. We're Team 16.
Oh, that's so disappointing.
It sounds kind of cool.
Yeah.
It's mysterious. Wow. Well, so thank you so much, Sir John, for taking part in the lightning round and for sharing the information on Psych Tank competition. Once again, if you want to learn more about the competition, go to mmheadlines.org. That's mmheadlines.org.
While you're there, you could check out other featured stories from this week. For instance, there were tips and resources that will help you limit email overload when you're enjoying a vacation this summer. And the Mock Golf Classic celebrated its 50th anniversary by raising $1 million for our children's hospital. Find all that and more at mmheadlines.org.
All right, Dan, we mentioned the 4th of July is coming up. What's your favorite way to celebrate the holiday?
Yeah, so I do love on the 4th of July, done by professionals. I do love the fireworks shows and things like that. And it actually, one of the things I remember, my coolest memory with the 4th of July was one year when I was in Lake Geneva, Wisconsin, which is just about an hour or two north of Chicago. And we were at a family friend's cottage, and they had a boat, and we would go out on the boat in the middle of the lake, and the fireworks were just right above you. And it was just like this really cool, you felt surrounded by the fireworks and things like that. So I love seeing the professional ones. I don't want to do any fireworks displays on my own. No, it's not safe, and I don't trust myself with that. But I do love going to see the professional ones. What about you?
Awesome. Well, on the flip side, I like seeing the unprofessional ones, especially the clips on YouTube where I'm at a safe distance. But no, I think normally we go to my parents' house, and we do have a little bit of a firework thing there. Each year I kind of, I took photos last year. This year I got a drone, so I want to fly above them, looking down on them.
Wow.
So if I don't have a drone after 4th of July, then
we'll know why.
So, but yep.
Awesome. All right, well, it's time for the weekly trivia contest. Last week, we asked listeners, what is the formal term for healthcare that respects and supports a patient's gender identity? The answer is gender affirming care. Congratulations to Carly Hendy, who sent in the correct answer. Now for this week's question, here's Hunter.
Thanks, Dan. This week's question is, what is the name of the task force that offer tips to employees on how to reduce work-related emails while on vacation? Once again, what is the name of the task force that offer tips to employees on how to reduce work-related emails while on vacation? You can find the answer to this week's headline story, and once you know it, send it to headlines@med.umich.edu for a chance to win a prize.
All right, that's all the time we have for today. Thanks, Srijan and Karen, for being here. And thanks, as always, to all of our listeners and viewers for everything you do for patients, families, and each other. We'll see you next week.